Welcome to Forthright. I'm Sulani Madsen, bringing you a podcast with last week's column written after an interview with Dr. Renata Moon. She ran into trouble for exercising her First Amendment rights to free speech. And an extra feature, a follow-up letter to the editor from a few days later that missed the point and made me laugh. From the column, first published March 28, 2024 in the Spokane Review, headline, "Speaking Freely Has a High Cost for a Former Local Doctor." When Dr. Renata Moon let her medical license lapse in Washington last March, it wasn't because she'd made a medical mistake. "Words can't describe what I see now, and with the loss of free speech in America," Moon said on a recent visit to Spokane from Florida, "I can't ethically practice medicine in a state where I can't have honest conversations with parents." What was this dangerous speech that got her into trouble? In December 2022, Moon accepted an invitation from U.S. Senator Ron Johnson, Republican of Wisconsin, to join a panel of physicians testifying in Washington, D.C. She arranged coverage of the classes she was teaching at WSU and attended as a private citizen. She made it clear she was not representing the university. And she questioned the U.S. government's official position on COVID-19 vaccines, still being used under emergency use authorization as the emergency subsided. She questioned why an untested vaccine was being pushed for healthy children who had a statistically near zero risk of fatality. She questioned the risk versus benefit, the kind of analysis the medical academy should be providing. Teaching has long been part of her life. Moon described her service on the admissions, DEI, and accreditation committees for the WSU Elson S. Floyd College of Medicine. "I can accurately say I was one of the founding faculty members of the school as a volunteer," Moon said. Her last paid position with the university was Clinical Associate Professor of Medicine, teaching first and second year students the basics of the art and practice of medicine. Her contract was not renewed at the end of the 2022-2023 academic year, but the free speech chill began earlier. Moon cared for some of the sickest children in the inland Northwest as a hospital-based pediatrician for 17 years before joining Kaiser Permanente at a Spokane clinic in 2019. She had always promoted the typical recommendations for childhood vaccination. When early in her career the rotavirus vaccine was pulled from the market, Moon said she felt assured the system was working. And then 2020 happened. The infection fatality rate for children was low and linked to comorbidities. After the early rounds of emergency vaccination, she started looking at the data in the Vaccine Adverse Event Reporting System for COVID-19 and comparing her observations with pediatricians around the country. Risk of myocarditis was clearly increasing. "If we're giving children something that may harm them, shouldn't we be telling parents what the risk is?" Moon said. "We recalled the rotavirus vaccine over less than 100 cases of rare reactions, but this is a human catastrophe." COVID-19 vaccination was added to the Centers for Disease Control and Prevention 2023 recommendations for birth through age 6 and is on the 2024 recommended child and adolescent immunization schedule for ages 18 years or younger. Moon does not recommend it for otherwise healthy children. She left Kaiser in 2021. She let her Washington license lapse in 2023 and retains her medical license in Idaho and Florida. Moon sees a direct parallel between how she was treated by WSU in 2023 and her mother's university experience under communist control in Czechoslovakia. Her mother often told young Renata the story of listening to her professor being berated by officials for teaching an unorthodox biology lesson in Mendelian genetics. Under communism, the Mendelian concept that specific traits might be inherited had been declared a pseudoscience. That professor was taken away and her mother never saw him again. Moon was taught to be careful when the family had rare telephone contact with relatives because government censors were listening. On a family visit to Prague at age 11, she was invited to secretly listen to Radio Free Europe with her grandmother and was proud to be a citizen of an America that stood for truth. She knew her relatives were not free to speak. Dr. Jeff Haney, chair of the Department of Medical Education and Clinical Sciences at WSU, filed a complaint with the Washington Medical Commission in July, after Moon's contract had already been terminated, quote, "to report possible spread of misinformation," end quote, for her December 2022 presentation to the U.S. Senate. Her words were contrary to the orthodox government interpretation of the data. Haney declined to comment for this column, saying only, "It is not my place to comment on or discuss current or former employees." But his report to the commission was an effective way to signal to other faculty to toe the party line or be unwelcome on campus. Academic freedom and democracy are under attack, not because we'll apparently be stuck with one of two grumpy old men in the White House. The Constitution is strong. It can withstand the drama. But not if we lose the First Amendment, not if we lose freedom to speak without fear of retribution. It was no surprise that feedback on the column was clearly polarized. The first email I received from a reader who's a fan said, "A great column this morning. The letters are on the way." And indeed, there was a letter to the editor published a few days later from Galen Gertzen. It was titled, "Madsen Continues to Cherry Pick." And I will read his letter in full. Sulani Madsen is cherry-picking again. Her recent column about persecution of Dr. Moon mentions the risks of myocarditis after vaccination. What she fails to mention is what else causes myocarditis, COVID-19 infection. And it turns out that the risk of myocarditis is much higher after infection than after vaccination. Maybe. In young men, the highest risk population for this side effect, the risk of myocarditis after vaccination, was about 0.0001%. She says the risk of mortality in young people was near zero, but so is the risk of post-vaccination myocarditis. I also find the comparisons to communist Czechoslovakia to be ridiculous and really tiresome. Dr. Moon has the right to say whatever she wants, but if she's going to teach medical students, she has a responsibility to deliver the evidence, the whole evidence and not just the evidence that supports her political view. And I mean political, since everything co-ed has become political these days. I think it would be great if the spokesman could find a conservative columnist who doesn't cherry pick and has a little perspective, but then I would be afraid I might be accused of wanting to send Ms. Madsen to Siberia. When readers send me email and I read them in a reader feedback, I don't give a whole name unless I have their permission. Galen Gertzen, his letter went to the editor. It was published in the paper. That makes his name fair game. He was a regular critic on email a few years ago, and we haven't spoken, and he hasn't written since he accepted an invitation to meet for coffee in November 2021. As I recall, he was either wearing 2 masks or an N95, even though most of the world had moved on. And he was very disappointed that I didn't want to be somebody he wanted me to be. Galen, you missed the point, but you did start my morning off with a jolly laugh. And actually, I would like to travel to Siberia and see what it looks like there. Some interesting stories. Take a look at where Alexander Solzhenitsyn spent some time, and there's someone who has a lot of thoughts on free speech. I'm not going to spend my time and yours, dear listeners, going through his assertions one by one on COVID, but suffice it to say he's done a bit of cherry picking himself. Galen's letter to the editor summarizes the general tone of the anti-column responders. Anti-vaxxer is one of those labels that is now used to describe anyone who has ever had any question at all about any vaccine, which is a very anti-science attitude. Science advances through questions. The strangest charge from one critic was accusations that Dr. Moon was guilty of malpractice, when in fact Dr. Moon has never had any lawsuits or actions against any state medical license, despite working with high-risk patients. That's incredibly unusual. Pediatrics is high risk for doctors because many actions are filed when people are disappointed with outcomes, what one doctor I know used to call bad baby cases, where there really wasn't anything the doctor could do. Columns are space limited, and I always have to leave something out. There is a longer version of one of the quotes from Dr. Moon that explains her point on the need to speak freely more fully. Dr. Moon said, "If we're giving children something that may harm them, shouldn't we be telling parents what the risk is? We recalled the rotavirus vaccine in the late 1990s over less than 100 cases of rare reactions with no associated fatalities that I'm aware of. Contrast that cautious move with the administration of the COVID-19 shot to children and young adults. We have many confirmed fatalities and injuries nationwide from these shots, and we can't even discuss risks without being persecuted. This is a human catastrophe." Labeling Dr. Moon's words as misinformation is rubbish. The point is, we must have doctors who are free to question and probe in order to maintain the quality of our healthcare system and to maintain trust in our healthcare system. And the First Amendment must mean something. Defending the First Amendment is the essence of the lawsuit filed by John Stockton, Children's Health Defense, which is RFK Jr., and 53 physicians against Attorney General Bob Ferguson and the Washington State Medical Commission. The complaint for injunctive relief on behalf of physicians being hounded by the state medical board for exercising their right to free speech cites Justice Robert Jackson's opinion in a case called Thomas v. Collins from 1945 as follows. It is not the right of the state to protect the public against false doctrine. The very purpose of the First Amendment is to foreclose public authority from assuming a guardianship of the public mind through regulating the press, speech, and religion. In this field, every person must be his own watchman for truth, because the forefathers did not trust any government to separate the true from the false for us, nor would I. Very many are the interests which the state may protect against the practice of an occupation. Very few are those it may assume to protect against the practice of propagandizing by speech or press. These are thereby left great range of freedom. This liberty was not protected because the forefathers expected its use would always be agreeable to those in authority, or that its exercise always would be wise, temperate, or useful to society. As I read their intentions, this liberty was protected because they knew of no other way by which free men could conduct representative democracy. It's a powerful quote. I'll print it in full in the Substack posting. And from President Barack Obama, he also defended free speech in 2015 when he said in an interview with George Stephanopoulos in a context of student protests, "We have these values of free speech, and it's not free speech in the abstract. The purpose of free speech is to make sure that we are forced to use argument and reason and words in making our democracy work. And you don't have to be fearful of somebody spouting bad ideas. Just out-argue them, beat them, make the case as to why they're wrong, win over adherents. That's how things work in a democracy." And I appreciate those words from President Obama. And that's why I'm part of Braver Angels, a group of people that are dedicated to arguing with civility, not afraid of hearing other ideas or even bad ideas. We need free speech to keep our democratic republic strong. And in case you haven't read it in a while, here is the First Amendment to the U.S. Constitution, number 1 in the Bill of Rights. Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof, or abridging the freedom of speech or of the press, or the right of the people peaceably to assemble and to petition the government for a redress of grievances. You can exercise your freedom of the press by subscribing to Substack with or without a pledge for notifications of new content via email. Every writer needs readers and every speaker needs listeners. Take advantage of the opportunity to comment, and thanks for listening.